Hey everyone, and welcome to Voices of Hope. I'm Ross Wilsey.
And I'm Mike Wade.
Each episode, we sit down to talk about what it means to live well, physically, emotionally, spiritually, and beyond.
We'll look at how wellness shapes us as individuals, families, communities, and even the wider world around us.
Through real stories and honest conversations, we'll explore what hope looks like and how it grows right here in the New River Valley.
Thanks for joining us. This is Voices of Hope.
Today we're joined by Dr. Sophie Wenzel, Associate Professor of Practice and the Associate Director for the Center for Public Health Practice and Research at Virginia Tech. She spent more than 2 decades working in public health, from serving in the Peace Corps and working with the CDC to leading community-focused public health efforts here in Southwest Virginia. Outside of her professional work, Sophie values time with family, enjoying the outdoors, practicing gratitude, and giving back to her community. Well, Sophie, thank you for joining us. I wanted to get a little bit more information about your work. Remind me what department you work in at Virginia Tech?
Yeah, so first of all, thank you both for having me here. This was great. I work in population health sciences in Virginia Tech. That's actually located in the vet school. Some people wonder why. So we function under this One Health umbrella. So animals, humans, and the environment and how they all relate to each other. So that's why the public health program is in the vet school.
I was wondering that.
Yeah. People always ask. And so I teach in the Masters of Public Health program, and then I do a lot of work out in the communities around Blacksburg, really throughout Southwest and Southside Virginia.
Okay.
Yeah.
So what exactly is public health, if you could define it?
Yeah. That's a hard one because in my humble opinion, public health is everywhere. So, throughout a discipline, and I'll tell you that public health is there. But basically in public health, we kind of take a step back and we look at populations versus people. So you think of like the typical medical model. You got one person, they're sick, and it's like, okay, how can I fix this person? But in public health, we look at whole populations, whole communities. And that can look a million different ways. So it can look like disease prevention, chronic disease prevention. It can look at like health promotion, all sorts of different topics, cancer, substance use, domestic violence, infectious diseases. It can look like data surveillance, injury prevention. The way I like to do it, so actually my neighbor, I have a teen neighbor who was asking me the other day, she's like, "What do you do, Sophie?" And so I was like, "Well, I work in public health." She's like, "What is that?" And so the best way I explain it to people is talking about like some of the bigger level policies, like seat belts or public health or helmet laws or like smoking laws. So kind of explaining like the big policy level. I feel like people understand public health that way because it's something that they've experienced versus like data and surveillance that may not be in their like every day.
Yeah.
So that's, like I like showing where public health is in all of our daily lives.
That helps. Picture. Yeah. How does it affect me personally? So that helps understand it better.
Well, and public health works a lot of times when people don't know it's there.
Mm-hmm.
Because a lot of public health is behind the scenes. It's the restaurant inspections, it's the prevention.
So it's to all of our benefits.
Absolutely, yes, 100%.
Yeah. So let's we're going to come back and talk a lot about public health throughout the conversation. But for those who are listening that don't know you, let's talk a little bit about your background, how you came to the New River Valley, all that good stuff.
Yeah. I've jumped around a lot. So I was raised in France. My mom was French. All her side of the family is still there. So we try to go back when we can to see family. I moved to New Jersey as a teenager. So I went from France to New Jersey. That was fun and exciting. And then I went to college in DC, studied Spanish and linguistics, which you think about it now, people are like, why are you in public health? I get there. So after college, I wasn't really sure what to do, wanted to do something of service to people. So I joined the Peace Corps. And I was sent to Paraguay, which is in South America, where people not only speak Spanish, but they speak Guarani, which is the local indigenous language. So I got there. They're like, "Great, you speak Spanish fluently? Okay, now we're going to send you to this super rural, remote village where you need to learn Guarani." So I did. I'm like, okay, challenge accepted. I love languages.
Wow.
And I was sent to be a health volunteer, even though I didn't have any health in my background. But since I already spoke the language, they knew I could learn languages. And so I worked in a small village with women and children, doing anything from like promoting vaccines, promoting nutrition, wearing shoes so you didn't get worms, just all basic public health. So I actually was doing public health before I really knew what public health was.
Okay.
And I remember sitting in the Peace Corps office under the mango tree, talking to another volunteer, and she's like, I'm going back to the US and I'm going to get my MPH. I was like, what is that? And she told me Master's in Public Health. She explained it, and I was like, I want one of those. And so that's what I did.
Oh, okay.
Yeah, came back from Peace Corps, got my Master's in Public Health at Emory. And then, long story, lived in Pittsburgh for a year when my husband was getting his Master's. And I worked at a domestic violence shelter there. So I did prevention, like going out in schools, but also worked doing intake at the domestic violence shelter. And I loved that work. I loved working with the women one-on-one and just being there to listen to them, listen to their stories, and offer them a safe place. And after that, I actually got a CDC fellowship. So I got to work in Atlanta for a year. And then they send you out in this fellowship to somewhere. And we picked Alaska. And so we lived in Anchorage, Alaska for 6 years. I ran a hair mercury biomonitoring program for 2 years. So we got to fly out in little planes to little villages and look at mercury levels in people's hair to kind of determine like maybe what kind of fish consumption levels they had, see if we needed to put out any sort of advisories or anything.
That's fascinating.
Yeah, it's sometimes I'd land at a village and I'm like, how the heck did I get to be here? Like, how am I so privileged that I get to experience this?
Right.
And just, they're extremely warm and welcoming. And yeah, and then we stayed in Alaska for another few years, and I managed an adolescent health program. And then we had kids, and our family was in Virginia and New Jersey, and we're like, why are we so far from family? And my husband had gone to Tech, so he graduated in 99. And we knew we didn't want to do the whole like I-95 East Coast thing. And so he's like, let's move to Blacksburg. And so I contacted the center director, Center for Public Health Practice and Research, where I work now. Met with her when I got here. And yeah, it all worked out. I didn't necessarily choose public health as a career, but it kind of happened to me. I was doing public health, didn't know it even had a name. I was told I was a community health volunteer, and then I figured out what public health was, and I was like, oh yeah, that's what I want to do. So yeah, public health happened to me, and I just kind of embraced it and never looked back. Like, that's just made it my career.
Awesome.
Yeah.
I just learned a lot about you. I did not know, even though we've known each other for years.
Yeah.
Wow.
I've hopped around. So I've been in Blacksburg for 13 years almost. This is the longest I've ever lived times 2.
Oh, wow.
It's crazy, yeah. And this is home now.
Yeah.
This is home.
Okay, I was going to ask you that.
Yeah. Blacksburg is home, Montgomery County, Southwest Virginia. Like, I've got that Southwest Virginia pride, even though I'm not like from here, but kind of feel like I'm from here.
Yeah,
the community's adopted me. I love it here. I don't think we're leaving.
Okay. Well, that's great.
Yeah.
It's good for us.
Yeah. So yeah, that's my long story.
Would you mind talking a little bit about your involvement with MCPP or Montgomery County Prevention Partners?
Yeah, pretty early on when I moved here, I didn't want to just be an academic. Like, I don't want to be just in my little academia box and just do research for the sake of research. Like, being involved with the community is so important to me. Like, all the work we do is community-based, with the community, for the community. And so it was kind of natural to join a local coalition. So I think I joined pretty early on.
Yeah, you've been around for a while.
I've been around for a while. Yeah. So yeah, I love it. It's a good way to see what's going on in the community, to kind of keep a foot in practice, in addition to the work I do with the health department. It's a way to see what's going on, communicating with people that are on the ground. Sometimes in academia, we feel really like we're removed from what's going on with people. So it's just a good way to know what's going on and to see what some of the issues are. So then when we go to submit proposals or do grant work, like, we can directly respond to community need based on what I'm hearing people are saying in the MCPP meetings. So, and also, like, I'm a parent in,
Right.
I've got 2 kids in Montgomery County Public Schools. So yes, I'm a public health professional, but I'm also a parent of these 2 kids. So I'm interested in seeing what's going on in Montgomery County.
Right. Yeah. And I know I've taken several things directly from those meetings straight to my kids, like after work, and just,
Yeah.
hey, did y'all know this is going on?
Yeah.
So,
Or opposite, like things my kids tell me, and I'll be like, well, actually, here's what kids are saying in schools. And
yeah.
so I feel like it kind of serves both ways.
Definitely.
Yeah.
Well, all that said, you are, in fact, an academic.
I am. I'm a pracademic.
A pracademic.
Practice academic.
Okay.
So, yeah. So,
Okay.
yeah.
All right. Well, thanks for making that distinction. But I do want to talk a little bit about, or get you to talk a little bit about your current role with the Masters of Public Health program at Virginia Tech and the Center for Public Health Practice and Research.
Yeah. So I do a bunch of different things, which keeps life really interesting.
Mhm.
I teach 2 classes. So I teach a public health leadership class and then principles of community health. Both of them are really like applied skills based. Like I want the students to get out of there with tools, whether it's like communication or negotiation or interprofessionalism, understanding social determinants of health, understanding health behavior theories. Like I want them to leave the class and be like, okay, I have this skill. I can go out and apply and do things. So that's the teaching piece. And then I advise students. And then we've got all of our research projects, and that's all over Southwest, Southside Virginia. It's anything from external evaluations to, actual randomized control trials, everything in between, a bunch of different topics. We do a lot on substance use, obviously, diabetes prevention, smoking, cancer. Recently finished a project looking at domestic violence and substance use in incarcerated populations. So yeah, lots of different things. And then there's my role with the health department.
Mhm.
So as part of my role at Tech, I work about 15% with New River Health District. So we have an academic health department, which is, if you think of like a teaching hospital where there's med students that go into a hospital, an academic health department is kind of the same, but at the public health level. So we've got our master students that get to work within the health department, either through like formal practicums or just little projects. I have a joint position, so I help them on whatever they need. Sometimes it's grant writing, sometimes it's I've been covering like actually going into the jail to help with that project. It's whatever they need. I try to jump in and fill that role. And I love that. That's really one of the favorite parts of my job, just because like they're doing the work. They're on the ground. Yeah.
Doesn't sound like you get bored.
No. I can probably say like I love my job 90% of the time. Like who can say that?
I mean, that's pretty good.
I know. I feel very privileged.
I mean, Ross and I, of course, can say
Of course you
100%
do.
of the
Yeah.
time.
Oh, 100%. Okay. It's all the bureaucratic stuff that's like I could do without.
Yeah.
But yeah, like the students just motivate me. They're, it's like they're just hungry and they want to learn and they want to go out and do good things in the world. And my colleagues are great. And yeah, I feel very lucky.
Yeah. That's great.
Yeah.
So you've mentioned the jail project a couple of
Yeah.
times. So would you mind telling us a little bit more about that?
Yeah. So it's a project that's run by the health department. So there is a health educator that goes in and works with small groups of women, and it's called Empowered Options, and they go over consent, substance use, neonatal abstinence syndrome, all different types of contraception, etc., just in an educational session. And then 2 weeks later, the health department comes in and offers contraceptives to whoever wants one. And then we do reentry planning with the women, just so when they get out, they are more likely to be able to connect with someone, find housing, case management, etc. So that project is ongoing through the health department. I'm not as involved with that. I'm helping with the management side of it, and then jumping in and helping. Like next week, I'm going in and doing some reentry planning, just sitting down with the women and just kind of talking through things. But an offshoot of that is a research project that I did. So a lot of the women were talking about a lot of stuff that had happened to them, like really bad stuff, domestic violence, substance use, incarcerated parents, intergenerational trauma. And so we turned it into a research project where I went in and conducted 15 interviews with women, just asking them about precursors to incarceration, kind of as a way to not just define them as inmates, but to show that they, like, a whole bunch of stuff happened to them to get them to the situation that they're in now. And so, yeah, we conducted these interviews, and then we did a thematic analysis, kind of looking at just some of the big things that came out. And so some of the big things are, a lot of them had experienced adverse childhood experiences. Most of them had some sort of personal experience with domestic violence, with substance use disorder, and with patterns and recurrence, and not just intergenerational patterns, but among themselves, patterns in domestic violence, patterns in substance use, patterns in going back to jail, just really having a hard time. But then there was also stories of hope. A lot of the women talked about their children and the relationship they had with their children, and really wanting to stop using substances in order to be reunited with their children. So it was, an incredibly powerful project. And the reason we did it was to tell these stories. So we created this booklet. Again, I told you I'm a pracademic. I'm not just going to do a research project and then publish it in the academic literature and done.
Right.
So we created this booklet that we've really tried to get out to as many places as possible, has a list of recommendations in it. So the last question I asked the woman was like, what could be done to help someone in your situation? So we've got recommendations around like need for more research, just so people really understand what's going on. Primary prevention. I mean, starting at Head Start, right? Like super early primary prevention. Trauma-informed education of people working in jails, domestic violence agencies, alternatives to jail. So maybe putting someone in jail 7 times in a row for not showing up for a court date is not the best way to treat them. So looking at alternatives, access to services in jail. So the health department is doing a fantastic job getting access to contraceptives, but access to opioid use disorder treatment, counseling, things like that. And then, of course, access to services post-release. So anything from transportation to housing to food to like all the services, counseling, of course. So yeah, it hopefully it feels like it's been a meaningful research project. I hope it is. We've gotten this booklet out as far as we can. And now we're hoping to take it a next level. Like, what are some policy implications? What are some things that we can look at where we can really make some policy differences? Maybe it's like different trainings that different people can get, or policies for access to treatment or things like that. So hopefully it's going to keep going places. Yeah.
Well, I'm curious, what was the biggest takeaway for you after interviewing these women?
Yeah. I mean, they're just people.
Yeah.
They're just women that have had a lot of really bad stuff happen to them. And it's not necessarily like they woke up one day and it was like a choice to do something that's going to land them in jail. It's like there's all these precursors that have kind of influenced their path to where they are.
Yeah.
So I think I mean, I kind of knew that going in, but just sitting and talking to them and hearing their stories, you're like, oh my gosh.
Yeah.
Like, yeah. So.
All right. So we've talked a lot about public health so far, and public health has been in the news quite often over the last few years, particularly during the pandemic. I think that's when the average person probably heard it more than they ever had before.
Yeah.
But with all that being said, it has, unfortunately, to some degree, I think, become politicized. But that aside, can you just kind of like give some thoughts on the overall landscape of where public health is in 2025 for people who are listening somewhere down the future? Kind of where we are right now in the fall of 2025 with public health, because I know it has an impact on funding.
Yeah.
Related to public health, and then also, quite honestly, probably impacts students that you work with.
Yeah.
Young people that are considering going into the profession. So maybe just give some thoughts on that if you would.
Yeah. So like I said earlier, people don't know about public health when everything's working fine.
Yeah.
So like everyone started hearing about public health during COVID, and then all of a sudden everyone was a public health expert. But yeah, fall 2025, there's a lot of challenging stuff going on for public health right now nationally. I feel like it's being less prioritized. Again, different people are becoming experts on something they may not be experts on.
Right.
Science isn't valued as much these days, and that's something that we all have to reckon with as scientists, as public health professionals. There's been cuts to programs. Money is not being directed towards public health and towards prevention as much as it was before. So that's something that we have to work with. We're trying to do more work with less time, because with less funding, it means that people that need the funding and that would have benefited from the programs are not getting those. So there's more work that needs to be done with less funding, basically. Mm-hmm. I mean, the work is still important. What I've told the students is now more than ever. Now more than ever, public health work is crucial. And so if they're feeling discouraged, I'm choosing this public health profession, is there going to be a job for me? The answer is absolutely, you need to keep doing this work, because more than ever, people like you, people that care, people that want to make a difference, people that, care about other human beings and seeing them thrive. We need those people. Yeah. We need these students. So yeah, it's hard conversations. It's not fun. It's difficult. And now more than ever, public health is needed and needs to be, we need to continue promoting it.
We need people to not be short-sighted.
Right.
And so that's hard to think long-term. Well, if we don't invest our time and energy into this now, what's it going to look like 10 years down the road?
Yeah. So. It's easy to be short-sighted, especially financially, but all the repercussions, all the kids that are not getting vaccinated for whatever reason right now, they're going to get sick. They may die. Mm-hmm. It's extremely short-sighted, and it's frankly is really scary as a public health professional. It really is. Yeah. Yeah.
And that's not being dramatic.
No.
That's just reality.
That's terrifying.
Yeah. Mm-hmm. Yeah. Well, we could probably spend a lot of time talking about that. But
yeah. Well, maybe to move things on a slightly brighter note, hopefully at least, what are some practices you have in your life, or things you do that you do to maintain your own wellness, whether that's physical, emotional, spiritual?
So I'm a big believer in work-life balance. And I teach this in my classes to students, to get them to not burn out. I work really hard, probably work more than my 40 hours a week. And I also play hard. Mm-hmm. So, I mountain bike, I do pottery, I spend time with my children and my husband. I live in a wonderful co-housing community. I cook community meals. I go on walks with friends. That's important. If I don't do that stuff, I'm not going to show up 100% at work for my students, my colleagues, and the communities. So yeah, work-life balance is key. I know sometimes people feel that it's hard, but work's going to be there. My family's not. Mm-hmm. So love my work, but honestly, if I were to quit, they'd be sad for 3 days, but I'd be replaceable. I'm not replaceable at home. Mm-hmm. And that's the most important thing for me.
It's a great mindset.
That's what matters. So that's how I keep myself healthy, emotionally healthy, physically healthy, mm-hmm. Is being surrounded by people I love and doing activities I love.
Yeah. I think we've talked about mountain biking before, but that's something I enjoy as well. And I did it back in college, but I started about 4 years ago. Nice. doing some mountain biking again. And yeah, I just did it yesterday and with my 14-year-old.
So many great trails here.
There are.
We are so lucky. It's incredible. We can leave our house and be on miles and miles of trails. My husband is a volunteer for the Poverty Creek Trails Coalition. Oh, cool. And they actually go out and build the trails by hand. It's pretty cool.
That is pretty cool.
Yeah.
Well, let's throw a little bit of a curveball at you.
Okay.
If you hadn't gone into public health as a career, what else might you be doing these days?
Yeah, it's hard to imagine because I've been doing public health for so long. I graduated college at age 22 and went into public health and haven't looked back. I studied Spanish and linguistics, so probably something related to that. Although if you think of it now, all of my research is qualitative, which that's linguistics. Like my data are words.
Yeah.
My secret dream after my master's of public health was going to work at a refugee camp.
Really?
I really, really wanted to go and do public health operations prevention in a refugee camp. And, I got married and moved to Pittsburgh. So, I still think about it sometimes, just like the raw need for just basic prevention. And I'm really good with just getting stuff done and coordinating things. So yeah, who knows, maybe one day. But definitely something with my languages. I speak French and Spanish. I get to use those very infrequently here, but I would like to more. Feels like this superpower I don't get to use as much as I'd like to.
Well, what you've just talked about doesn't sound like that far of a stretch from what you currently do for a living. So
I think that shows how much I love what I do.
I was gonna say,
I can't find an alternate thing.
I think that phrase "living the dream." I think maybe you're tasting a little bit of that, huh?
It's like I said. I feel very lucky in my current position. I feel very lucky living in Blacksburg in the mountains.
You're making everybody that doesn't live in this neck of the woods that's listening right now very jealous.
Yeah. Move to the mountains.
We'll be expecting a sponsorship from the Chamber of Commerce.
We like to ask everybody the same question. What does the word hope mean to you?
Gosh, that's a good one. I think, I don't know, believing that something good's coming your way. Something good is around the corner, whatever that looks like for you, because it's going to look different for everyone. But not necessarily something better, but something good coming around.
I love it. All right.
Yeah.
Well, before we let you go, any final words of wisdom for our listeners?
I think I'll start by just expressing gratitude. I've already done that a lot, but gratitude to you all first for having me on the podcast, and then gratitude for my colleagues, my students, gratitude for my community, my family, the mountains, Southwest Virginia, the communities here, the people here that have just embraced me. I mean, I came here in 2013 from Alaska. No one knew who I was. And I have felt just embraced and welcomed by everyone, so much that, it is now home. So yeah, I think just that gratitude. And then words of wisdom, I'll go back to that work-life balance. If you can, find that time for your family and for just a little bit of joy.
Yeah.
Yeah.
I think that's a great way to wrap it up.
Yeah, it is.
Yeah.
And we are truly grateful for you.
Thanks for having me.
For being a guest and for taking time to talk to us. And I'm sure we'll see you around soon.
Yeah, probably at the next MCPP meeting.
Yeah. Thanks again, Sophie.
Yeah.
Thanks.
Yeah, thanks for doing this. I think it's great to lift up community voices.
We're doing what we can.
Yeah.
Because this is the Voices of Hope podcast.
Nice.
Thanks for listening to Voices of Hope.
If you enjoyed today's conversation, we'd love for you to rate and review the podcast and help us spread the word.
Voices of Hope is a production of New River Valley Community Services.
To learn more or listen to past episodes, visit nrvcs.org/podcast.
And remember, hope grows when we share it.
So keep the conversation going, and we'll talk to you next time on Voices of Hope.